I want to make welcome Mrs. Okonlawon. She's an ENT nurse, Chief Nursing Officer at the Lagos State Ministry of Health. Please, a round of applause for Mrs. Okonlawon. Thank you very much for coming, ma'am. Thank you so much. And beside Mrs. Okonlawon, we have Dr. Olubi. He's a consultant and a lecturer at the Lagos State University College of Medicine. Please, a round of applause for Dr. Olubi. Thank you so much for coming, sir.
You're welcome.
Thank you. Dr. Olubi, can you explicitly define the word ear?
The ear can be defined as one of the sensory organs located at the right, the side of the head. Okay. It is meant to conduct sound, process it, transmit it, and present it to the brain for proper understanding.
One of the major key organs of the body. So, yeah. Mrs. Okonlawon, how can we take care of this ear? How do we protect our ears?
With the caring of the ear, we'll start by saying, normally we advise people that normally you don't tamper too much with your ear.
Okay. Because
the ear itself is self-cleansing. But in case you need to clean your ear, you can only clean the external part of the ear.
Okay.
What I mean by the external part is the area you can see from outside.
Okay.
So, and when you are cleaning, don't clean with that, the sheep cutting board. I mean the ones they sell 10 naira. Because it can easily fall inside the ear. Okay. And when it does that, that's giving you another problem. And you come back to the clinic, you spend money to flush it out. Instead, we say, if you must clean your ear, you go for the good quality cutting board and clean the external part.
Dr. Olubi, do you want to shed more light on that?
Yes. I must say that if you're going to clean your ears at all, you clean it with your elbow.
How do we do that?
It is impossible. That means don't.
Okay. Oh.
The ear has a natural mechanism of cleansing himself. It's just like a conveyor belt. It goes slowly and actually get everything out. It is also contained of some sebum, oil-like substances that make sure that these things flow out. So naturally, you don't need to touch the ear.
Okay.
Except if you're going to clean at all, you clean just the external part with a slight inside of the hole, not going in at all.
Okay.
Because this is going to disturb the mechanism. And if it does, there will be accumulation.
Now, let's talk about hearing problem as one of the major prevalent problems with the ear. So what do you want to say about that?
Hearing problem, well, the hearing problem is growing a lot in Lagos State. We tend to see a lot of them in the clinic. And with the environment now, we're tending to get a lot of more patients that will come and present in the next 5 to 10 years. One of the major causes of this is the noise around, the noise pollution.
Okay.
The second one is the indiscriminate use of drugs. And prescription drugs are easily obtainable in the chemist without prescription.
Okay.
So a lot of them can actually cause damage to the ear. Other things like injections and some other illness can actually damage the ear. Expatiating on those of the noise, generator noise, aircraft, train, blowing of horn on the streets, all these things can actually, noise in discotheque, people putting earphone and increasing to a very large volume. All these things can actually damage the ear, apart from
Mrs.
trauma.
Okay, Mrs. Okonlawon, what are the symptoms we see if you want to be sure you don't have hearing problems, or if you have, if you think you have it, what are the symptoms to look out for?
You mean for hearing?
For hearing, yes, hearing problem.
Those people that has hearing problem, when you look at them, when you talk to them, they don't hear you well.
Okay.
And in most cases, they turn their radio, their television in high volume.
Oh, okay.
And when you talk to them or you call them, they don't hear you on time. And when they are watching television, they sit in front of the television.
Okay. Okay. Are there any more symptoms, doctor?
Well, the symptoms are mainly what she's mentioned.
Okay.
The other thing is that the person that is concerned is now dissociated because it's not hearing the conversation and now goes to sit down in a separate place. I can't hear them. Why should I be with them? The other thing is that the patient is unable to appreciate the environment. Okay. There are a lot of noise going on in the environment and the patient will just not knowing. There may be, oh, run away. Don't go to the left, and the person is actually seeing people running and run in that opposite direction because he can't actually hear what is being said properly.
Thank you very much. A round of applause for our guests.